In this video, we're going to draw the borders and contents of the femoral triangle. The femoral triangle is a triangular shaped depression at the proximal aspect of the thigh, or sort of in the groin area. So we're going to start by marking two bony landmarks. We're going to have the anterior superior iliac spine laterally and the pubic tubercle medially. Now these two bony landmarks are connected by a ligament, and this is called the inguinal ligament, and the inguinal ligament is just the inferior border of the aponeurosis of external oblique. Now to make a triangle we need two more borders, and these borders are muscular. So if we start from the ASIS, we know there are two muscles that attach to the anterior superior iliac spine. We do have tensor fascia lata, but the muscle that we're interested in is the other one, and that is sartorius. So we're just going to draw sartorius coming down the thigh, like so. And sartorius does angle in this way. Okay. And the other muscle is one of the adductors that attaches to the pubic tubercle. So we're going to mark this third border, and this is actually going to be adductor longus. And I want you to remember that adductor longus is the border of the femoral triangle, because when you're in the lab, sometimes it's hard to distinguish the three adductors, longus, brevis, and magnus. But if you can identify this triangle, it's fairly obvious which of those muscles will be adductor longus, and that's a great place to start. So those are going to be the borders of our femoral triangle, and next we're going to add in the contents. So we'll start from lateral, and the first structure that you'll see laterally is the femoral nerve. Now the femoral nerve is not a solid nerve like you might expect. I always tell my students this is like a nerve explosion. So the femoral nerve has reached its destination in the anterior thigh. It's going to supply all of the structures in that region, and so it's starting to split up into all of its smaller branches. So it's not a nice neat nerve that you'll find there. It's a whole collection of nerve branches. Altogether we will refer to as the femoral nerve. If we move medially, the very next structure is going to be an artery, and that is the femoral artery. Of course, if you have a femoral artery, you're going to have your femoral vein. Now the femoral artery is a direct continuation of the external iliac artery, and the femoral vein, if we think of it heading back towards the heart, will become the external iliac vein. We're then going to leave a little bit of a space, a slight gap, and I'm just going to draw in some dots here that are going to represent the lymphatic system. The lymphatic system isn't something we really cover in Kin 100, and it's not usually very visible in the lab actually, but it helps us with our mnemonic. So in order to remember the sequence of these structures, we'll put up the initials. So we've got nerve, artery, vein. I'm going to put E here, which most people just usually refer to as an empty space, and L for lymphatics. So we've spelled the word navel, which is another word for your belly button. And if you want to, you can just remember that you have to read from lateral to medial or towards your belly button.